is patient friendly or not, and what are the doubts, common doubts which the patients have about insulin, and whether they are right or wrong. So insulin, I believe, is a very, very useful and a patient-friendly drug. Before its discovery in 1921, a patient who was once diagnosed with type 1 diabetes, it was just like having a death sentence. But with the use of insulin, the life expectancy increased significantly. And now, from increasing life expectancy, we are focusing more and more on prevention of the dreaded micro and macrovascular complications of diabetes, for which we need to have a tight control, and we have to maintain that tight control for long, which unfortunately is not a very easy thing to do because of the progressive nature of the diabetes. At the time of diagnosis, about 50% of beta cells are already gone, and further decline in the beta cell function continues, which thus necessitating a continual adjustment of our treatment. And insulin, for that matter, is the most potent glucose-lowering drug. And keeping in mind that some of our patients have a very high HbA1c or glycosylated hemoglobin, we sometimes do need this drug to start even in the newer cases who have a very high blood sugar levels, or the patient are very symptomatic. Now, this useful drug is not being used so commonly because there's a big clinical inertia in the minds of the physicians as well. They fail to intensify the therapy even when the patient's blood glucose levels are much, much above the advised targets. And thus, the patients are exposed to prolonged uncontrolled glucose, and they are also exposed to increased risk of developing diabetic complications. So we need to educate our patients, because and our physicians as well, so that this drug can be used much earlier and at an appropriate time, rather than using it as a last resort. Now, some of the common doubts, the myths which the patients have about insulin are that, well, the biggest phobia is about the needle injection, because they think that it is a very painful thing. No, that is not correct these days. This could be true in the past when the needles were quite long and painful, but now the needles we have are very small, where they are laser sharpened and silicone coated, and practically they cause no pain at all. And so the patients, once you demonstrate that the needle injection is painless in a chamber, they are ready to accept it more gladly. Another very common myth which the patients have about insulin is that it causes complication. So many times they say that my grandmother was sick, she was put on insulin and she developed heart problems, she lost her eyesight, her legs got amputated and all those. Explain to the patient, it was not the insulin which caused all these things. Rather, it was the long-term uncontrolled diabetes which was responsible for the complications, and hence the patient ended up with those troubles. Another very common with the patient says, doctor, am I being prescribed insulin just because I failed in achieving or failed in my treatment, or they have the doubt that they are being given insulin as a punishment. Tell them that it's not that they have failed in their treatment, or it's not that they are being given it as a punishment. Diabetes is a progressive disease. Over time, the oral drugs are bound to fail, and they will be needing insulin to supplement and achieve a tight glycemic control. And well, as far as the safety of insulin is concerned, they many times say, sir, aren't the oral drugs, oral hypoglycemic agents safer? Tell them insulin is in fact the safest drug. It can be given in any condition, whether it is liver failure, kidney failure, and above all, it is the only drug which is which is actually recommended in a female with pregnant female with diabetes. So that way, it's a very safe, effective drug. And unfortunately, due to the myths and doubts which both physicians and the patients have, it is not started at an appropriate time. And I think the message should go, we should use this drug more actively and at appropriate time to avoid the complications of diabetes. Thank you very much.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.